attention to engineering profession. All right, we'll begin with health matters as the Minister of Health, Dr. Osage Ihanire, debriefs press on planned COVID-19 vaccination as Nigeria finalizes arrangements to roll out the COVID-19 vaccines beginning today. The minister says the vaccination exercise, though a game changer, should not be regarded as the end of all other safety measures against the global pandemic. He was speaking at the second edition of the State House weekly briefing focusing on Nigeria's response to the COVID-19 pandemic in the last 1 year. State House correspondent Adam Sambo reports.
Of 156,963, out of the number, 135,831 have been treated and discharged, while 1,939 people have died of the disease.
You will agree that with the leadership of Mr. President, Nigeria has actually mounted a very robust response to this outbreak. And you know, when things go wrong in our country, we often blame government. And when they go right, we thank God.
This is the network service of the NTAi. We now join our outside broadcast crew for a live telecast. Please stay tuned.
That we keep standing while I recite the national prayers. O God of creation, direct our noble cause, guide our leaders right, help our youth the truth to know, in love and honesty to grow, and living just and true, great lofty heights attain, to build a nation where peace and justice reigns. Amen. Please be seated. The Secretary to the Government of the Federation and Chairman, Presidential Task Force on COVID-19, Mr. Boss Mustafa, Honorable Minister of the FCT, who is our host or landlord today, Malam Mohammed Bello, Honorable Minister of Health, Dr. Osage Ihanire, the Honorable Minister of State for Health, Senator Dr. Mamura. We have also with us here the Director General of NAFDAC, Professor Mojisola Adeyeye. We have who is also here as the man who has conducted and ensured that we are all witnessing this today, the Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shuaib. We also have here with us, as we are borrowing this ground, as it were, but with the permission of course, the government and every one of us here, we have the chairman of the National Hospital, Right Honorable Patricia Ete. You're welcome, ma'am. I'd like also to quickly recognize that we have with us the Chief Medical Director of the National Hospital, Dr. Jaff Momo, and the Chairman CMAC, and of course the National Hospital team that have been working tirelessly to ensure that today comes into fruition. And I think they all deserve a round of applause. As we go on, I'd like also to mention that we have with us members of the diplomatic Corps, and the development partners. We have my lords, temporal and spiritual. We have a very, very important traditional institution who is today represented by the Sarkin Jiwa, His Royal Majesty Alhaji Dr. Idris Musa. From the diplomatic corps, we have here with us the UN delegation represented by Alexandra Boyes Gomez. You are welcome, sir. I know that WHO is here. UNICEF country representative Peter Hawkins, you're welcome. We'd like to recognize, even they're not here, but they have facilitated the arrival, and of course, final destination of the vaccine, the Gavi. Would like to recognize Gavi. From the British High Commission, we have Dr. Sam Agbo, Senior Health Advisor, who is representing that part of the Commission. Today is not so much about ceremony or who is here and there. Today is about us as a people who have come to witness how we can prevent, how we can ensure, how we can cause a plateau, how we can make it happen and achieve a COVID-free society. And since we have everyone represented, coming in immediately now with me, let's welcome him, the Senate Chair on Health, distinguished Senator Ibrahim Oloriegbe is here with us. So everyone here is welcome. My name is Mujima Kojola, and please let me just say that when I invite you for your intervention, make it as brief as possible. What is important for us today is to witness that Nigeria has fulfilled the promise of government to ensure that on each arm will come a jab that will ensure that we reduce the spread of COVID-19. At this point, Your Excellencies, all very distinguished ladies and gentlemen, I'd like to invite the Executive Director, National Primary Healthcare Development Agency, let's have the dignitary come in. Of course, yes, I think we have here the Speaker of the House of Representatives. Thank you very much, sir. The Right Honorable Bajamia Mila. You're welcome, sir. I did announce at the very beginning that our chief host, popularly known as the landlord of the FCT, is here with us. I'd like to invite the Honorable Minister of the FCT, my brother, Madam Mohammed Musa Bello, to please give us a welcome address. Thank you very much.
Your Excellency, the Speaker of the House of Representatives, Right Honorable Femi Bajamila, the Chairman of the Presidential Task Force on COVID-19, and the Secretary to the Government of the Federation, Mr. Boss Mustafa, the Honorable Minister of State, the very distinguished Chairman of the Senate Committee on Health, and other members of the Senate present here, including members of the National Assembly, the Honorable Minister of State for Health, and other ministers present here, distinguished officials of the primary healthcare department as well as NAFDAC, members of the diplomatic corps, our frontline health workers, the Chief Medical Director of the National Hospital and his entire staff, distinguished ladies and gentlemen, members of the press, a very good morning to you. On behalf of the FCT administration and the entire citizens of Abuja and the FCT, it is with delight and a deep sense of responsibility that I welcome you all to this national flag of the COVID-19 vaccination exercise taking place here today at the National Hospital, Abuja. The flag off signifies real optimism and finally will turn the tide against this pandemic that has so affected all of us in Nigeria and the world over. And permit me at this point to extend our sincere appreciation to all the hard workers in the FCT and the entire nation for having worked tirelessly over the last 12 months to make sure that all of us stay safe and alive. During the process, many of the health workers paid the supreme price while fighting this disease so that all of us will rest. We recognize their effort and all of you currently fighting in the battle against this disease. What we are witnessing today is the culmination of effort of a lot of dedicated Nigerians who have worked tirelessly and dedicated time, energy, and resources to make beyond the call of duty to make sure that the COVID-19 is made available. His Excellency President Muhammad Buhari has provided focused and unwavering leadership, and without doubt, the efforts of the Presidential Task Force on COVID-19 under the steady leadership of the Secretary to the Government of the Federation, Mr. Boss Mustafa, has provided guidance and implementable strategies that has worked for us all. I am happy also to say that in the FCT, we have all concluded preparedness through the cold chain assessment so that, and I want to assure you that we have capacity to store, distribute, and make sure that these vaccines are well kept. And I want to also mention that within the FCT, for instance, we already have designated 65 vaccination points in the 6 area councils for the first phase of the implementation. And these are 25 points in the municipal council, 10 points in Buhari, 10 in Gwagwalada, 8 in Kuje, 7 in Kwali, and the remaining 5 at Abuja. I want to end this address by calling on all the FCT residents to continue to take steps to contain the virus, particularly the well-accepted non-pharmaceutical interventions that has worked very well for us. Having said that, Your Excellency, distinguished ladies and gentlemen, once more, we thank you. We thank all our development partners for the hard work that has been done on this. And I do pray that with the flag off of this vaccination exercise, we are now going towards the end of COVID-19. Thank you, and God bless you all.
Pleasure to welcome you to this telecast today, coming to you live from the network service of the NTAi. And of course, we are reaching you from the National Hospital here in Abuja. The event is the official flag off of the vaccination against COVID-19. My name is Kenneth Nanim. On behalf of the entire outside broadcast crew, I say welcome to this telecast. Minister of FCT, Malam Musa Bello, had also given his address. He appreciated all health workers in the FCT and across Nigeria who are in the front line, making sure that Nigerians are safe. And also President Muhammad Buhari, who made it possible. He assured that the FCT has all it takes to secure and also store these vaccines for the use of Nigerians, and urge residents of the FCT to come out and take this vaccination.
Thank you very much. Please be seated. Thank you. Quickly, we'll move on to goodwill messages from partners, agencies who are here represented, and leading that pack today, and who is speaking on behalf of all of them, is the country representative of the World Health Organization, WHO. Dr. Walter Mulumbu will speak on behalf of all our partners as I invite him. Please let us welcome him warmly.
Your Excellency, distinguished Honorable Speaker of the House of Representatives, Your Excellency, the Chairman of the Presidential Task Force and Secretary to the Government of the Federation, Your Excellency, the Minister for FCT, Excellency, the Minister of Health, Your Excellency, Minister of State, DG, Executive Directors, partners, I would like to stand on existing protocol. Today, I'm really excited and I'm honored to be delivering this goodwill message on behalf of all the partners, starting with those who put in place the COVAX facility, which is a collaborative effort between UNICEF, Gavi, CP, and WHO. Today, we are truly proud to witness this historic event, the flag off of the COVID-19 vaccination in Nigeria. Until recently, it seemed to be a dream. It gave all sorts of messages, news in the press. But today, we are happy to see that Nigeria received its first dose, its first batch of COVID-19 vaccine, and Nigeria will be administering this vaccine, this first dose, to healthcare workers to protect them. They've been our shield, and we need to honor them. I would like to ask the attending community to observe a minute of silence for those we lost to this fight and they were not lucky enough to receive this vaccine today. Thank you. Distinguished guests, member of the press, let me also take this opportunity to congratulate truly the Nigerian government. The Nigerian government, from the highest level of the state, of the country, have shown exemplary leadership. We have witnessed an effective COVID-19 response in this country. A catastrophe was predicted. A doom was predicted. We did not see it because Nigeria was among the first countries to really impose courageous public health and social measures. This is what allowed us to get on top of both the first wave and now the second wave. That's why we are really happy to have this additional tool, the vaccine, which will help us accelerate the end of the acute phase of this pandemic. But let me take the opportunity to remind all of us that it's not the vaccine alone. Until everybody is covered, we will still continue, we will need to observe public health and social measures. We need to deny this vaccine the opportunity to further multiply and mutate to create variants of concern. WHO, together with the other UN agencies and partners, we are here to support that effort until such time that COVID-19 will be history of the past. I thank you.
Thank you very much. Quickly, I'd also like to say that Nigeria has always been in the forefront of fighting not just epidemics, but also we will fight and ensure that we nail the coffin of COVID-19. I want to hear an amen there. And I know I can see that members of the Rotary Club are also present here. You are all very welcome. You did a good one with polio. We hope that together we will fight COVID-19. I'd also like to recognize that we have the Permanent Secretary, Federal Ministry of Health here with us. Please, shall we put our hands together for him? We are moving on steadily as I now invite the man who has, and his team, his able team, that have all been able to put all this together. Before he comes and I bring him to the microphone, shall we please all appreciate members of the team led by the National Primary Healthcare Development Agency. The government spoke to bring in the vaccines in, and we are flagging it off here today. So welcome with me the Executive Director, NPHCDA, Dr. Faisal.
The Speaker of the House of Representatives, the President of the Senate, hereby represented by the Chairman of the Senate on Health Services, the Chairman of the Presidential Task Force on COVID-19, and the Secretary to the Government of the Federation, the Honorable Ministers of Health, distinguished ladies and gentlemen, permit me to rest on already established protocol. On behalf of the team at the National Primary Healthcare Development Agency and the partnership, it gives us great pleasure that we're witnessing what is, without a shadow of doubt, a watershed moment in our lives. I want to first and foremost recognize the untiring efforts of the Chairman of the Presidential Task Force on COVID-19. Without his leadership, we wouldn't have been here today. Please, can we give him a round of applause? Your Excellencies, distinguished ladies and gentlemen, our being here today has been also because of the leadership that we've been able to follow, the leadership of the two Ministers of Health and the Permanent Secretary of the Ministry of Health. Can we give them a round of applause? Can we give a final round of applause to the men and women who have worked so tirelessly to make sure that the numbers of people who died from COVID-19 in Nigeria are the barest minimum? Today, we're going to be administering the first dose of the AstraZeneca vaccine to a frontline health worker. By doing this, we're symbolizing what we've been saying for the last few weeks from the Presidential Task Force on COVID-19, that we're going to be prioritizing those who in the last 1 year have sacrificed on behalf of all Nigerians to make sure that those of us who contracted the disease are treated in a humane way, are treated in a way that really replicates the best traditions when it comes to the quality of medical practice. Today, we'll be administering the vaccine to a medical doctor who has been in the front line in the treatment center since March of 2020. Can we give Dr. Cyprian a round of applause? We want to appreciate the CMD and the Board of Directors of the National Hospital for providing us with this environment. I want to, on this platform, wrap up by saying we've said it long before now, that it is not how fast, but how well. It is not how fast we get the vaccines here, but making sure that we get the right vaccines for our environment, getting the right vaccines that are suitable for our cold chain infrastructure. Earlier today, we got the news from our sister agency, the NAFDAC. The DG NAFDAC is here. Her team worked tirelessly over the last 48 hours to do the final checks to the vaccines, and she gave us the good news that apart from certifying that these vaccines are safe, they've done the final checks and we can go ahead with the vaccination. Can we give NAFDAC a round of applause? We took all of the measures that were required, more measures than many countries took when it came to selecting the vaccines for Nigerians. Yes, there was a lot of talk about the delay. Yes, there's a lot of talk about why we are not starting when other countries were starting. But we realized that it is more important that we got WHO emergency use listing, that we also looked at some of the more stringent regulatory agencies before we finally asked NAFDAC to assess the vaccines. They've done all of their work, and I want to put it on record again that the vaccines that we're going to be delivering today to Nigerians are safe, they're effective, and we're going to roll out this vaccine in a very efficient manner, just like we all work together as one country and defeated the wild polio viruses. Today, it feels proud to be a Nigerian. All of you should be proud that finally we're taking that determined step to turn the corner when it comes to finishing the job of controlling COVID-19 in Nigeria. Thank you very much. God bless you.
Thank you very much, Dr. Faisal.
That's Dr. Faisal Shoaib, the Executive Director, National Primary Healthcare Development Agency of Nigeria. He has commended the PTI for doing a very nice job, led by the Secretary to the Government of the Federation, Boss Mustafa, and the medical team. He also assured Nigerians that NAFDAC has certified the vaccines to be safe, and they will be administered to Nigerians from now.
He's a very happy man coming here. So, can I invite the Honorable Minister?
Your Excellency, the Speaker of the House of Representatives, Your Excellency, your distinguished Senator Oloriegbe, here in his own capacity and representing His Excellency, the President of the Senate, the Chairman of PTF and Secretary to the Government of the Federation, and our landlord, the Honourable Minister of the FCT, Honourable Minister of State, and Royal Fathers here present, Permanent Secretary, Development Partners, Chairman of the Board of National Hospital, and CMD and staff, we thank you all for accommodating us here today. The long-awaited day is here, on which Nigerians can now join others in the global community to be vaccinated against the dreaded COVID-19 virus. For us in the health sector, it is a relief and the marking of the start of a tedious but hopeful exercise to see our fellow citizens develop immunity against this virus. As has already been announced, I am happy and also relieved again to announce that at 12 minutes past midnight today, I got the text message informing me that NAFDAC has certified this vaccine for use. Otherwise, we would not be sitting here today. It would have to be postponed. It has been a harrowing past 1 year to helplessly follow the gradual increase of COVID-19 casualties in our country, especially among health workers in our midst, which was also depleting the human resource for health and making it all the more harder to tend to other people in need of health care. Every life lost to this pandemic mattered, but the loss of health workers compares to soldiers lost at the war front and is therefore laden with sentiment. The vaccination campaign we kick off today will be in 4 phases and will align with the planned arrival of vaccines in batches. Each phase targets a specific segment of our eligible population to ensure equity in the vaccine deployment. The defined frontline healthcare workers are prioritized globally for vaccinations against COVID-19 due to their higher exposure to the risk of infection with COVID-19 in the course of duty It stands to reason that this protection is not only for their own sake, but also for our own sake, since any one of them absent due to illness means, again, a depletion in their ranks and can forebode staff shortage. It therefore makes sense to cater first to those who cater to us. The next prioritized group are those who, if they become infected, are at high risk of severe disease. These are the elderly and the vulnerable, as defined by presenting with pre-existing conditions like obesity, diabetes, chronic kidney, respiratory, and heart disease, and cardiovascular diseases and other medical conditions as identified by their doctors. Ladies and gentlemen, all eligible groups must get vaccinated as and when due, while the non-eligible groups should respectfully await their turn. The vaccines are more than enough to go around, and they'll be coming in phases. Persons under 18 years and pregnant women are for now not eligible, except they have been medically certified as vulnerable due to one underlying ailment or the other. The reason for them not being generally eligible now is because there is no scientific assessment yet of the safety for persons under 18 years old of age and pregnant women. That said, let us encourage the elderly and those with known underlying illness to be vaccinated, and so to shield the community, the loved ones, and ourselves from COVID-19. We have taken steps to ensure vaccine security and accountability, but we must also warn against any kind of foul play or underhand dealing in this exercise. Any infraction will embarrass us and will be sanctioned swiftly. This campaign must be done according to the books, which have been so elaborately put together by the Ministry of Health and the National Primary Healthcare Development Agency. So I urge citizens to be vigilant and to report any unwholesome practice or attitude to the police or to the Federal Ministry of Health. These vaccines are our common assets, and the responsibility is on every person to protect them and ensure proper use. The Federal Ministry of Health and NPHCDA desire an impactful and successful vaccination campaign. It is important that all sectors key into the federal government's homegrown strategy for the COVID-19 vaccination, which is known as the TEACH phenomenon, and the Electronic Management of Immunization Data System, EMID. I urge all states of federation and the FCT to align with the initiatives in order to have a peaceful and orderly campaign across the country. I want to use this opportunity to thank the dedicated staff of the Federal Ministry of Health, led by the Permanent Secretary, Mr. Abdulaziz Mashi, the NPHCDA, led by Dr. Faisal Schwab, and particularly our donors and our partners who have walked this very hard way with us. I also remember recognized members of the UN agency who have always supported us with their single basket idea, and also with the technical support they have always given us. Worthy of recognition must be the vibrant members of the media who I see arranged right in front of me, almost more than the number of us sitting on this side, who have done their duty by following developments in the health sector since COVID-19 broke out in February 2020. Today is primarily a day for vaccinating our healthcare workers. I want to tell you that we are very proud of you all. I wish you well and urge you to continue to give your best to the country and to fellow men, whatever the circumstances. Despite the beginning of this vaccination exercise today, I would like to emphasize that we are not out of the woods. Yes, there is light at the end of the tunnel, but we are still in the tunnel. We are not out of the tunnel. We need to continue as strictly as before with the non-pharmaceutical interventions, the public health measures, the wearing of masks, even if you have been vaccinated, the social distancing, the avoidance of crowd, and all the use of sanitizers and measures that have been expressly sung over the months in order to have a full benefit of this exercise. We are aiming for herd immunity. We are aiming to vaccinate 70% of the population. We are also aiming to look after the interests of our neighboring states in the West African sub-region with whom we have a lot of human traffic. Because as has been said by the Director General of the World Health Organization, no one is safe until all of us are safe. Thank you for your attention.
That has been Minister of Health, Dr. Osagie Ehanire. He has welcomed Nigeria into the Committee of Nations who have joined in the vaccination of citizens against COVID-19. He also emphasized that the vaccines are safe for Nigerians to take, having been certified by NAFDAC. And he also emphasized that the vaccination will be in phases as health workers have been prioritized at this point in time, and after which the elderly people and those who are considered to be vulnerable will also continue to take the vaccination. And he also made it clear that persons under 18 and pregnant women are not eligible for now unless they have underlying ailment. Meanwhile, the minister also urged Nigerians to continue to maintain all the non-pharmaceutical protocols stipulated against COVID-19 while the vaccination continues.
Our next VIP to speak to us on this historic day where Nigeria has joined the global effort to rid us of COVID-19. I hope that we'll put that together as we listen to him. While that is being done, let me just say that 4 medical staff will be here today to be administered the vaccine. These are men and a woman that have risked everything. They're married, they have children, but that for them is not the concern. The concern is for them, to ensure that they save more lives.
There's a breach of protocol.
There's a breach of protocol. Okay. I've just been informed that the order has to be reordered. So I seek the indulgence of everyone around, Your Excellencies, very distinguished ladies and gentlemen. You'll all agree with me that the federal government has taken the containment of COVID-19 very, very seriously, putting it at the office of the Secretary to Government of the Federation, who also is the chairman, PTF, on COVID-19. He came here right on time. That's to show the seriousness for which the government or this administration has taken the containment of COVID-19. And so, on your behalf, Your Excellencies, all very distinguished ladies and gentlemen, and of course, members of the Nigerian vibrant media, I'd like to invite the man of the moment, Boss Mustafa, to please address us.
Well, some of us are laterally endowed. Your Excellency, the Speaker of the House of Representatives, the representative of the Senate President, Chairman, Senate Committee on Health, members of the Federal Executive Council here present, permanent secretaries, our development partners, Chairman and board members of the National Hospital and Management, the Executive Director of the National Primary Healthcare Development Agency, our health workers who started out as our first line of defense and later became our last line of defense. Distinguished ladies and gentlemen, gentlemen of the press, today marks another great milestone in the response to COVID-19 pandemic in Nigeria. We have every cause to be hopeful and more determined to win this war. The human activities that culminated in the arrival, authorization, and distribution of vaccines have shown that humanity, when working for a common goal and unity of purpose, possess the capacity to achieve a lot. This is more so because the virus spread around all countries and territories of the world with alarming speed, recorded millions of fatalities and infections without discrimination on the basis of sex, creed, tribe, language, and even status. For us in Nigeria, and indeed nations of the world, the lessons to be drawn from this lack of discrimination by the virus are numerous. They include the fact that we must approach the vaccines phase with unity of purpose. 2, we must understand that nobody is safe until everyone is vaccinated. And 3, we must recognize that vaccine hesitancy will impact negatively on our lives and those of our loved ones if allowed to foster. 4, we must demonstrate at all times that this is a war of NTAis plus vaccines for the survival of everyone. And 5, we must believe our government on the safety and efficacy of the vaccines brought to Nigeria. And lastly, we must support the planned and systematic rollout of the vaccines and mobilize our citizens as we move into the states. In keeping with our promise, the Presidential Task Force is prioritizing the frontline health workers in the first batch of vaccines received. They have fought hard to save us. They laid down their lives for us, and in the ICUs and treatment centers, they became our last line of defense. On behalf of the President of the Federal Republic of Nigeria, the government and the people of Nigeria, I salute our heroic frontline medical personnel for their professionalism and commitment to saving lives. This ceremony is just the beginning of a well-detailed vaccination plan that will reach every eligible Nigerian at the appropriate time over the year 2021 and 2022, when we hope to have covered over 70% of Nigerians and achieve herd immunity. The vaccines will be arriving in batches, and I urge all Nigerians to be patient with relevant agencies of the federal government and subnational entities managing the deployment process. This is a novel rollout, just like the virus was a novel virus. Let me state categorically that vaccines are very sensitive, life-saving commodity, and the only authorized source is the federal government that has signed indemnity with the manufacturers. I therefore appeal to all Nigerians not to patronize fraudsters who are out to defraud, get rich, and in the end, endanger your lives. We must all be vigilant. On behalf of His Excellency the President, I now have the single honor and privilege to flag off the vaccination of eligible Nigerians against COVID-19, beginning with the frontline medical workers, to the glory of God. And I thank you for listening.
That has been the Secretary to the Government of the Federation, Boss Mustafa. He has urged Nigerians to remain steadfast in this project. He has also said that we must continue to be vigilant and that the government is the only certified entity that will handle the vaccine in terms of importation and administration, and urged Nigerians not to patronize any other source. He also emphasized here that before 2022, Nigeria, hopes to achieve, or rather vaccinate about 70% of the population. He also helps the commitment of the health workers who have been on the front line, by showing commitment and professionalism in handling this pandemic.
We'll continue. I'm getting all kinds of good news coming on, and as soon as I'm able to put them all together because of time, I'd also come speak to the public about it. But in the interim, it's good to know that our lawmakers have also identified with the drive to contain COVID-19 in Nigeria. So at this moment, Your Excellencies all, very distinguished ladies and gentlemen, and members of the Nigerian Vibrant Media, I'd like to invite to the microphone the Honorable Speaker, Honorable Femi Gbajabiamila, to please address us.
The Senate and House Committee Chairman and members of the National Assembly here present, the Secretary to the Government of the Federation and Chairman of the Presidential Task Force, the Federal Capital Territory Minister, Health Ministers, DGs. Allow me at this point to stand on the existing protocol, and of course, ladies and gentlemen of the press. Let me first start by very quickly putting it out there that as you can see in the program, I'm just here to observe a very epical moment in the history of Nigeria, in the history of the world actually, where we seek to inoculate almost 200 million people in this country. That's why I call it epical. It's been one long year of torture, of sadness, of a change in lifestyle from what we have already been established as our lifestyle. In doing that, let me thank the SGF and his team, because we have to remember how we got here, because we're very quick to forget sometimes. It's been about a year now, and the President put together a team led by the SGF and supported very, very ably by the ministers, the relevant ministers, and health personnel. I want to thank you and your team for what you have done and how you have led us to this point. I remember that time a year ago when the whole of Nigeria witnessed a daily briefing from the SGF and his team. I emphasize the word daily briefing because it's not a mean feat to sit down or to stand out there every single day and keep Nigerians abreast, transparent to Nigerians, briefing with facts and with truth. And whilst we like to compare ourselves with other countries that are well organized, we saw how they did their daily briefing and how in a matter of 30 days, a month, they had to stop. Not because they didn't have the capacity, but because it was so difficult to keep abreast with the way this thing was ravaging the world. The way the virus was mutating and there were just different things were coming up. They stopped, and I'm talking about America. But our SGF and their team continued on the daily to brief us, to answer questions, and I think that is commendable and deserves another round of applause. Thank you very much. I must also thank, on behalf of the National Assembly and therefore on behalf of all Nigerians that we represent, the health workers. The health workers have been the major, should I say, source of success for where we are today. For a country of almost or over 200 million, yes, many will say, oh, we don't have reported cases, we don't have statistics. But even with the statistics we have, 200 million people, and to record the number of deaths that we have, I think the health workers have done so well. They've put their lives on the line, and they have manifested what it is to be a true Nigerian. The can-do spirit that many of us often forget that we have in this country. And I think they deserve even a bigger round of applause. So we're now a year in, and we've started our journey to recovery, to reach a level of herd immunity that we all seek or we all long for. In this journey, let me very quickly preempt our journalists. We're a country of 200 million people or thereabouts. Whilst I expect the journalists and the press to continue to play their very important role of checks and balances, I want to please implore and charge and ask that we do it with a sense of responsibility in our reporting and not give to unfounded rumors. And this is a time for us to rally behind the government, because like the SGF said, the virus knows no creed, knows no religion, knows no ethnicity, knows no sex, knows no age. So it is time for all of us to come together as a country, because as I've often said, we're actually in a war, but in a war with an unseen enemy. And therefore, when a country goes to war, you go as one. So I want to implore the journalists, I want to implore Nigerians out there, not to give in to conspiracy theories, because we will hear them. We will hear conspiracy theories. There will be stories about, no, this virus is better than, this vaccine is better than that one. Vaccine is a vaccine is a vaccine. There are so many out there, Moderna, Pfizer, AstraZeneca, which is what we have today, that will do the job. And so we should encourage the government in providing and rolling out more and rolling out as many vaccines as possible. We have about 4 million now, and there's many more coming. The rollout plan is just as important as the vaccine itself, and that's what we should do. Even in countries where they have fewer in terms of population, they have issues with rollout because this is new. And so we will need the encouragement of the Nigerian people. We must not play politics with vaccine. We must not play politics with the health of our neighbor. We must be on the same page. Whilst we also correct and do what you need to do in terms of your role in checking the government and holding the feet to fire, to their feet to the fire, we must do it with acute responsibility. From my understanding, the vaccine has a 12-week in between the first and the second dose. And from my understanding, the longer that interregnum, that period of between first and second, the more effective the vaccine is. From the research and the questions I have asked. AstraZeneca has been proven. Some people say it's 60-something% effective. Well, if it's 60-something percent effective, I have asked questions as well. But apparently, it's because it was the last, one of the last to come out just before the Johnson & Johnson. And by the time it gets to 12 weeks after the first dose, it gets to the stage of 90-something. That's when it hits the 90-something percentile, from my understanding. But whatever the case is, I'm sorry? Yes, I mean, the chairman, Senate Health Committee just said I was applying for Masters in Public Health. Well, I'm sorry, the issue of, what do you call it now, the issue of this virus is not the exclusive reserve of you doctors. This is public health that concerns all of us. And I can tell you that some of us are so concerned, even the man out there, that you'll be surprised that he knows more than you. Because this involves lives. Maybe some friend or some relative has dropped dead. So we do our research, but I still give deference to your professional knowledge. I think I owe it to the Nigerian people to also educate a little bit on the full implication of vaccination. I don't want us to go away thinking once you've been vaccinated, that's the end of the story. Like was said earlier on today, no, that's not the end. That's just the beginning of the journey until you take your second vaccination. But even then, we have to be mindful of the person that has not been vaccinated. So my understanding again is that once you've been vaccinated, you develop a level of immunity and you cannot be sick again. But from my understanding, whilst that can happen, the virus can still come into you, but it's ineffective in you, but you remain a carrier. You still carry the virus. Am I correct? Aha. So, if that be the case, for those who are lucky to get vaccinated early enough, understand that whilst you are safe, you may still be carrying the virus, and so you need to protect your neighbor. And so you need to continue to wear the mask. You need to continue to observe those protocols that were followed for a year, as inconvenient as it may be. You need to continue to wash your hands. You need to continue to wear your face mask and wear properly, except when you're speaking at a podium. So for me, it is important to send that message, to Nigerians that even though you've been vaccinated, you must continue to observe that protocol until we achieve that level of herd immunity. So I want to thank everybody once again. I want to thank the people who put this together. God bless you all. Thank you very much.
That has been the Speaker of the House of Representatives, Femi Gbajabiamila. He has also, narrated some of the harrowing experience that the Nigerians have been through in the last 1 year as a result of the COVID pandemic, and he has also urged Nigerians to rally around the government, support government to ensure that we overcome this pandemic. And just like he also said, he also urged media practitioners to make sure that what they report is factual, and has also made it clear that these health workers who have been in the front line also have done well in their profession and also in their duty to ensure that we remain safe. And he also urged Nigerians to continue to keep and adhere to the non-pharmaceutical protocols stipulated against COVID-19.
Hear from the representative of the Senate President, His Excellency Senator Lawan, ably represented today by the Chairman, Senate Committee on Health, Senator Ibrahim Oloriegbe. Senator Dr.
The Speaker of the House Representative, my brother and my leader, Right Honorable Femi Gbadabe-Amila, the Secretary to the Government of Federation and Chairman PTF, whom we have all collectively, including the Minister, be awarded Masters of Public Health honoris causa, isn't it? So I can assure you of that has been granted. Honorable Minister of FCT, Ministers of Health, Development Partners, head of various agencies here, I stand on all existing protocol, but I recognize the members of the media here. I wouldn't have to say anything other than to say I rise to second and adopt what has been said by the Right Honorable Speaker. And so I said, as such, because I think he has said all he has to say. Other than to say that the President of the Senate wished to be here. In fact, yesterday we had discussion when he gave me the mandate to represent him. As the Speaker has said, with his invitation that he does say we have to give a speech, and I don't have a speech. That's why I have the liberty to adopt what has been said by the Honorable Speaker. Thank you all, and God bless.
All right, thank you very much. We will now move on to the vote of thanks, and you can see that this is a bit changed on the agenda. We'll take the vote of thanks so that we can draw attention to what actually brought all of us here today. After the vote of thanks, my colleagues, by the Honorable Minister of State for Health, we will move now to the vaccination center. What do you want? I'm not... Okay. All right, this is democracy. This is democracy. And the SGF has agreed to this, and Chairman of the PTF, so thank you, sir. All right. Please, before we start, I have appealed to my colleagues, particularly the still photographers. Please take your positions. You are already there. Please be seated. Thank you. This is historic, and everybody wants a vantage position. Thank you. As we kick off this flag off, it is important to note that the agency responsible for vaccination of all Nigerians is the National Primary Healthcare Development Agency, ditto State's Primary Healthcare Development Agency. It is in the reality of this that, Your Excellencies, all very distinguished ladies and gentlemen, I would invite the Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shuaib, who will be the person to administer the first vaccination on one of the frontline health workers. Let me just say here that please may I ask that you all leave so that we can capture every moment of this historic time. I'm sure we all can get our shots.
Nigeria recorded the first case of coronavirus on the 27th of February 2020, and since then has been grappling with the challenges and making sure that the virus is contained. Well, with the vaccines now available, the hopes have risen for Nigerians.
From the National Hospital, I was reliably informed that he has been at the isolation center from March 2020 when this pandemic broke in Nigeria.
Now Nigerians are about to witness the historic event now as the first vaccine is going to be administered to a medical doctor. Now the Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shabu, is the one giving the vaccination.
Done.
So I just wanted to take the opportunity to show that with this vaccination card, we also have a QR code. This is one of the requirements of the Presidential Task Force, so that if anybody needs to travel out of the country, once this QR code is scanned, it brings up the information of Dr. Cyprian, so that it shows exactly what vaccines he has taken, the AstraZeneca vaccine, when he took the first and the second doses, okay? And it will also show his photograph. So this is also an electronic card, as it were, because of the QR code. This card also contains the exact batch number of the vaccines that he has taken. Thank you very much.
Thank you very much. Dr. Cyprian, thank you for your sacrifice. The next recipient is Dr. Joseph Nuru. Tahir, sorry. Okay. The next doctor to be vaccinated is Dr. Tahir Yunusa. Dr. Yunusa today has saved on record 10,549 patients. He has seen more than these, but saved the lives, and I think he deserves a very loud round of applause. The Gwabalada Isolation Center it was the first isolation center, and we're still counting, but just before we started this, he said to me that that center has saved 10,549 lives and still counting as we speak. Let me also say that with this exercise, more health workers are being trained so that they are perfect at what they do, not just here in Abuja, but across the states. Okay. Our nurses have been trained, and they are doing what they know how to do best. Thank you. Can we have Dr. Joseph Nuru? Oh, okay, for now. I've been told that the vaccination will continue. But can we have the nurse? Can we have the nurse? So that it's not just doctors. Yes, sir. Can we have the nurse, please? To show that men and women. The nurse, yes. Can we have the nurse to be seated, please? The nurse, this vaccine has no gender barrier. Let Doc.
This vaccination exercise is just a demonstration of the flag off of vaccination against COVID-19 here in Nigeria. I also understand that there have been a place, prepared in the trauma center for other health workers. So as soon as this ceremonial exercise is over, the vaccination will continue in the trauma center where other health workers, nurses, doctors alike, as well as other supporting staff of the hospital will also go in to take their vaccination.
The last doctor, please. Thank you very much. Your Excellencies, all very distinguished ladies and gentlemen, may I please call on the Honorable Minister of State for Health, Senator Dr. Mamura, to move the vote of thanks. Huh? One person, okay. Do we have a recipient who would want to speak before the vote of thanks? Yes. Quickly, please. Thank you very much.
The doctors that have received the vaccines, or rather the health workers, are those that have been in the isolation centers who come in contact with the patients of COVID-19, and today they have been vaccinated against the pandemic COVID-19.
Okay. All protocols duly and respectfully observed. My name is Dr. Cyprian Ngong. We've been at the forefront of the COVID-19 fight here in National Hospital, our isolation center, under the able leadership of the National Hospital. They've provided everything we need for this fight. We've lost some, we've got some, and we are happy we are getting the vaccine now in Nigeria. I think that is about the best news we've had since. I only wish my dad had had that vaccine maybe months ago or so. We lost him, but we thank God. And the fight is still on and we will win. Thank you.
That's Dr. Cyprian Ngong, who just received the vaccine against COVID-19.
I've taken this vaccine and I have taken the vaccine today. Thank you very much.
Thank you. Thank you very much.
He believes that Nigeria is really going to win this war against COVID-19, and he's also optimistic that this vaccine will also go a long way to contain COVID-19 pandemic in Nigeria.
Realistic for us in this country. Please, I'd like to call on the Honorable Minister of State for Health to please move the vote of thanks. Sir.
Thank you very much, Moji. Your Excellency, Mr. Speaker, the People's Speaker, thank you very much for being part of this. The SGF, who incidentally is the chairman of the Presidential Task Force that has led the response activities thus far. And of course, we have to confer on him public health expert, because he has done so well. Our host minister Minister of FCT, and my colleagues in the cabinet, and our royal fathers here present, and the media. Thank you very much for what you have done. Now, this is the day we've been waiting for, and now we have seen it happen in terms of the vaccination of some frontline health workers. 3 messages have resonated from day one that the pandemic broke out. First is the message of national unity, and that is what has brought us thus far. We are united against a common enemy. The second is the message of global solidarity, and it's that message of global solidarity that has got us the vaccines we are using right now through the COVAX facility. The third message is that message of hope that tomorrow will be better. And we are seeing it on a daily basis that tomorrow is getting better. And I will overcome. I cannot but lend my voice to what has been said in terms of conspiracy theory. It is fake news. Please be ye warned. Don't be surprised if somebody is peddling that rumor and that person might have taken the vaccine long time ago, like it happened. You all know where I'm talking about. Please don't be fooled. This is the best that we can hope for. In a pandemic situation, the ultimate is the use of vaccines. That is the ultimate, and that's where we are right now. So, in the struggle, in the response activities so far, so many people, we thank God that we are alive right now. I cannot but say it again, that those who peddle fake news about conspiracy theory, what they are doing is a kind of desecration of the memories of those who are dead already from this pandemic. Secondly, it's a disservice to frontline workers who are taking their lives. So we should not give in to that. So I want to thank our partners, international and local. I want to thank CAR COVID in particular and all other donors that have been part of this. But I cannot but thank our President, President Muhammadu Buhari, who has given every support, and I mean every support needed to get us to where we are today. I want to thank all the frontline workers and all other workers in the health sector that have been part of this. I want to thank all the arms of government, particularly the legislature, that has always approved what is brought before them in course of our fight against this. Both in the House of Representatives and, of course, the Senate President, the Speaker, thank you for your support, and, of course, the committees of health of both houses. I want to thank the media. The media, you have done excellently well. But for you can't light a candle and put it under the table. It has to be on top of the table, and you have been the candle that shines the light of what we do. I thank you so much. I want to thank the cleaners who work in the hospitals, particularly in the ICU, in every other place. I thank the cleaners. These are people behind the scene. We hardly see them, but they do so much to keep us all safe. I want to thank the ambulance drivers. Thank you so much for what you do. I want to thank the ward maids. All of you have been wonderful. Even the technicians that work in the hospitals. You sort out the issues of light, the issue of water, name it. I thank you so much. I thank you so much. And I have to do this because it's in line with that saying. One English writer said that gratitude is not just the greatest of all virtues, but the mother of them all. So we are grateful to you all. Thank you very much.
Indeed, gratitude is important. And I'd like also to add my voice to appreciate the traditional and the religious institutions that are present here. Before we finally take our leave, I'd like to ask members of this side, the front row, to please have a group photograph with able medical frontline medical workers that were administered the vaccine. And whilst we are there with the group photograph, we'll take the national anthem. And I want to thank you, all of you, and I hope that it will spread the good news of the fact that Nigeria is on the verge of ensuring that everyone, at least 70% of Nigerians, are administered the vaccination. Please, let me also say here that every scientific method has been put to play. I know that running concurrently now on the social media is that the vaccinators were not wearing gloves. Once you sanitize your hands, you can vaccinate. Please mind social distance. So every protocol, every adherence has been put in place to ensure the safety needed for the administration of the vaccine. Thank you all. Have a wonderful afternoon in Abuja. And please, social distance is still in place. Social distance is important. Wear your mask on your nose and your mouth, not on your chin. Ensure that you constantly either wash your hands or sanitize it. It's important that we do that, and there are a lot of sanitizers around to ensure that you do this. Social distancing, even as the photograph is taken. Can we quickly have the national anthem, please? Can we have the national anthem, please? The national anthem is on.
To the end of this program, the flag off of vaccination beginning from the health workers who have been in the front line fighting against COVID-19. And meanwhile, the seriousness attached to the fight against the pandemic by the global community has also been emphasized, including efforts by the national response team, the media, health workers, and of course our dear President Muhammadu Buhari, who made this day possible. And again, Nigerians are being reminded to dispel all conspiracy theories and make themselves available to take the vaccine to ensure we contain COVID-19 in our country. On behalf of the entire outside broadcast crew, Kenneth Nanim is saying thank you for being part of this program.